Hey YouTube, new video. On this one, it's kind of a common project with Discord. So on the Prepper Guild, I started something new that every month I'm trying to do the case of the month. And this month was about kidneys. And so I did a case. And a few people answered. And so I told them that I would explain what I would do in that situation. And I wrote on the Discord channel that obviously I can be wrong. This is more like my professional opinion based on things I read, and I'll put some link of some of those resources. And but it was an interesting thing. It's more for an exercise to what do you have in your kit. Would that work? And I did exactly the same thing. So the rules were that try to use things that you have, not that you would imagine that you have. And in a certain way, the point of the exercise is that if you don't have it, then you can go get it. So I'll read the case that I did. And so you and two members of your group are on a scavenger expedition post disaster X. You're about 1 or 2 hours from the rest of the group. After X, most of the grid went down, but there's a few cities that are still functioning with some medical support. But the closest from you is about 5 days away. While you're looking for something, you hear a large noise followed by a scream. You rush to see. You find some of your companion having his leg pinned under a heavy object, something in like 300 pounds and more. Describe what you would do. So that's how it started. So the case basically what it talks about is a thing called cross syndromes, and what I wanted to kind of emphasize is that there's a few things that you really need to do about, and they're pretty common, especially in places like earthquakes. And there's a very specific treatment that you need to do with them. First, safety. So if one object fell, that means other object could have fell. So if you're gonna help someone, that's the first thing. So you have to assess: are you as safe? Anything else can fall on you. So especially if you're in the earthquake situations, is there a risk that other object could have fallen? And now there's not only one person injured, but many person are injured. So safety is the first thing that you need to look for. But let's say in this case, everything seems to be okay. It was just uh, something that was heavy that the person went to try to grab something under and it fell on him. So the second thing that you now need is time is your enemy in this case. So what cross injury syndrome is that in our cells we carry, especially in the red cells, there's hemoglobin. So that's where the oxygen hook on it, and it's a pretty big chunk. And what happened is that when your cell dies, they kind of explode, and it can release whatever they have inside. One, like I mean, or all the red cells, I think they have about a 3 month survival cycle, so they always die and recycle. But if it happened in a big chunk, so for example, if your leg is trapped and it release, what happened is that the hemoglobin part gets and goes to our kidneys, which are kind of little filters, a little bit like your coffee filter. Well, if you ever try to filter anything and a big chunk on it, what happened is that nothing can go through or even injured. And so what happened is what we call myoglobulinemia, which is basically your urine becomes this very specific urine. It's like tea color orange. What that means is that there's myoglobin in it, which is basically that molecule that it's part of the hemoglobin, and it start going through your kidneys, and it can clot it, and basically you can become in renal failure. So this is why we're saying that time is your enemy. Is that longer the items is on the person, longer that deaths happen. And also now is that longer that this myoglobin is released and goes to your kidneys, is harder to, it gets thicker and thicker basically, and then it becomes very hard to avoid. And so having urine. So in this case, the problem is that you have only one other person, and the rest of the group is about an hour. So some of the people were suggesting trying to lift, which is a good strategy. Again, now there's no right or wrong, because again it's principles. So here your as time is your enemy, is to try. The only problem though is that if you don't have proper people, so if you don't have the proper gear, the proper equipment, the proper thing, you can make even more damage than anything. So in medicine it's always do uh, don't do more arms. And in this case, what can happen is that if you try to lift, so for example, let's say I fell on the knees and you tried to lift, and it was just, it crushed at, because that it fell, it kind of crushed under certain events. Well, now if I'm trying to lift and for a reason you didn't do a good job, and or you're not strong enough, or you're about to fail and that refell again, so now you created even more injuries. And so you have to be sure that when you're lifting, this thing will stay lift. There's different techniques that you can do. There's some great videos, and I'll post, especially in CERT teams. They kind of teach that, and basically you're trying to put stabilization items outside just enough so that you can lift that person. So it's not about lifting the items completely off the person, but lifted it off just enough that you can pull it out. It's called cribbing, and you can put it over there. And I'll link a video on the CERT team that I saw, which is good in practice in the past. So you can do that. There's also, I just found, there's a little items now that I carry in ADC, and I don't know if it would work completely with this, but there's little bags that you can pump, and that's what the obviously they're much stronger. They lift like uh, kilos of weight, like cars and things like that. And basically the beauty with them is because they're flat, you put them in there, and then when you put the air in, it lifts the item and stabilize them. And so I found them, they were about 20, and I'll link one of those items. And then now I'm carrying them in my ADC because that could be one use of it. There's other use I'm thinking of it, and they say, I think they're about 300 pounds for them, and so that would be maybe enough just to pull that person on. The other concern you may think, so if you're thinking, so for example, if the situation is not safe, then it become life or limb. So what we're meaning by that is that cutting the thing that is stuck in to be able to save a life. Is that another possibility? Again, it's your decisions, but that's another possibility. It's to get basically that person out of there. So whatever decision you decided to send either a group or to lift, if I didn't have enough possibility to lift the other person, I would have probably sent for help. But now basically the person is there, and longer it takes, because basically an hour, so that means an hour to go, another hour to come, that's 2 hours. So that means that person is staying with the gear, but now you have a team as well, because don't forget also, when we're talking about rescue, if you think you're going to grab somebody, like if you go for example with search and rescue, a team is going to be 10 and 12 people with a lot of advantage, like roles and things like that. And the reason is because carrying someone is very demanding. It's time consuming. It's very demanding on your body. It's demanding as well on the transport that you have. So it's not as easy as movies seems to make it look. So sometimes you may need a lot of people, or to bring this person from A to B. if usually you would walk in, let's say, in an hour, maybe now I can take 2 hours, 3 hours, 4 hours, and you can get a little bit tired. So one thing that I carry in my kits is for this kind of purpose, if I want to rescue someone, is just a simple hammock. You know, the ones that you can find like at uh, uh, in a store at like $10. They're kind of cotton and a little bit cheap, is because the advantage of those ones is that you can cut it. And so if the person, for example, is unconscious, you can put their head inside the hole, upside down, and so basically they keep their maintain their airway open as they're trying to transport. So that's one items that I do have in my kit. So in this case, let's say we do succeed to lift this thing and we bring it out. Now the part that we need to do is monitor their urine, and this is one thing I didn't say. A lot of people were focusing on the wound itself, stopping the bleeding, which is obviously very important. But in crush injuries, a lot of time bleeding is not the issue. It's what you don't see, which is what's happening inside. So all those um, myoglobin getting released in the blood, and also another one that is dangerous is that as cells die, cells control the usual cells in your body contain a lot of potassium, and so now you have a lot of release of potassium, and that can make your heart very unstable. In the past, they used to say that if you have an injury like this, to put a tourniquet to prevent so that shots of potassium. But when I read now some of their literature, they don't recommend. They said it was very negligible. But what you really want to make sure though is to dilute that. And so what you want to do is have a very high input of fluids. Now, fluids, it depends on who you have. Obviously, in the medical field, we always recommend, for example, that would be a good case to start on IVs, but now how do you carry it? And I did videos in the past with that. But one that you could do if the person is not unconscious, it make them drink a lot of fluid, and stay clear of electrolytes for those ones, because obviously the potassium can be high. So you want to be sure that the fluids that they take are not concentrated on potassium, because that's actually a danger for them. But you want them to drink a lot, and what you want is to drink enough. So what's drink a lot is that you want to see the urine output, and this is the really important part. And urine output, the measurement is zero point 0.5 to 1 cc per kilo per hour. Again, 0.5 to 1 cc per kilo per minute, per hour. Sorry. So that means that if you're 70 kilo men, that means you need to pee at least 70 cc of urine every hour, and that would means that you're producing enough urine, so that means there's enough fluid going inside you to go out. And actually, you even want to go higher up, because you're trying to get rid of a lot of that crap that is releasing by all those cells. And so, how do you monitor that with somebody on there? So, the first thing is in my kit, I carry. So, for example, if this person would be conscious, I would make him drink. If the patient would be unconscious, I would put an NG in, and then I would feed them that food like this. But if they're unconscious and you're giving fluid, don't forget that you have to keep them sitting up, because obviously they could vomit, and now they could go into the airway. So you want our airway, breathing, circulation, like your basic first aid. So I would have to try to keep them sitting up as much as I could as I'm doing transport, or I'm transporting another way. But you want to get those fluids in. Another way that I train and I carry is subcutaneous IV fluids. You can give up to about 250 cc's an hour, which is pretty decent for this situation. Basically, all you would have to do is take a bunch of skin kind of and goes under. There's videos out there, and I'll link things. But again, depends on your training and the gear that you carry with you. But the thing that you really want to monitor is their urine, because if their urine is going down, that means their situation is getting worse. And obviously other signs and symptoms, like if they were conscious, they're becoming unconscious. But you want to make sure that there's a lot of fluids to those kidneys. And the one way that you can monitor the urine, so either if you have catheters in, so Foley, I mentioned that on my channel a few times, put that in and then you monitor every time that it pees, because as urine is produced, it's going to come out. And so that's a great way of measuring. But if you don't have that, putting a catheter, a condom catheter, that's a kind of an exterior, so you don't need to put a tube. Also, I mentioned that, but that works mostly for men, not for women. Foley works for both. But the third way that you can do, if you really like, I don't feel comfortable putting tubes in people and things like that, is to carry baby diapers. And you can put that like inside their pants and hold it. But now, how do I know how much is in there? Well, it's by weight. So when I used to work in pediatric, that's what we used to do, is measure. So you take a dry. What we would do is we would zero the scale at with a dry, the same mark, obviously, of a dry um, diaper, and then we would put a diaper that was wet, and each gram equals 1 cc. So if you have a 70-gram diaper, that means you have 70 cc's of urine in there. And so that's a great way of doing this. And what you can do is buy a little those luggage uh, kind of scales, or different scales. Personally, I don't carry that kind of stuff because I'm mostly going to put tubes in people, but that would be an option that you could have in your kit that would make not too expensive and without a lack of skills and stuff. So now that we are monitoring her vital signs, and we're monitoring her her assessment and stuff, taking the pulse of the person, um, and we try to be careful also about when we transport them, not to be too bumpy, because again, the heart, because of that rush of potassium that can be more sensitive. And then going what we call ventricular fibrillation is what you learn when you do CPR. Basically, the heart goes and it's very disorganized in his treatment. Instead of like being like this, it's kind of going all over the place, and basically you won't feel any pulse at that point. And it's hard to get them out if you're in there. So this is why prevention is the greatest thing. Obviously, those people will need a lot of care, so they needs to go to that in 5 days. But personally, what I would do is not go from the scene to there, because you'll need a lot of resource, you'll need a lot of planning, and by two people walking for that 5 days is way too much and not really not really recommended. So what I would bring is bring back to your camp, and then from there have a some do a further assessment, have a better plan, have something that you can go. Maybe you can sound a scout to kind of announce to people. Maybe they do have like some possibility of like maybe there's helicopters that still function or an ambulance of some sort. So you send somebody in advance, and then you have another party that will carry this person with the proper gear and stabilization. But what I wanted to bring a lot with this kit is this case was urine output, very important to monitor, fluid, and fluids, depending on how you're able to give it according to your knowledge and skills and the gear that you have, and the urine output to monitor that, and also not to worsening the wound. Uh, the wound itself, so obviously whatever was crushed, sometimes there's no actual wound, because basically what happened is everything kind of scratched and then it gets so there's no open wounds, but the bone inside is broken and blown up and everything, but it's not really a wound itself, it's just everything is smush. But if you do have an open wound, those ones are very at risk for infection, and not only infection of the wound, but especially if you have a bone that basically when it broke, it went through the skin. Now you have an open bone, and infection can get inside the bone, and now you're in big trouble. So any wounds that would have been that you could have seen from wounds, I would put AG dressings on there. I would treat that right away, just as a burn or something that is very open. So that would be redressing for that. Obviously, you have to stop the bleeding if there's a bleeding. Tourniquet could be important for those in some of those cases, and maybe amputation, like we were talking about, could be a possibility. But anyway, I wanted to do a video about how I would have approached that situation. I hope that the people that saw it on Discord and in here too found it interesting, the exercise, to see, like, what you do have in my kit, what do I need to add to my kit and situation. Sadly, I find a lot of time on YouTube we always talk about gotcha wounds and things like that, but those are more realistic things that can happen, and we have to be prepared for them just as well as gunshot wound and all the other ones. And they're more complex because they're there's more components of thinking, and again, there's no right or wrong answer, because depends on the situation, depends on your group, depends on the equipment that you have, your skills, your knowledge. And this is why I hope that everybody does the exercise on their own, so that they can self-learn from what they have and what they should do, and do a search while the grid is up. So anyway, I hope you liked it, and I'll talk to you soon.